The STITCH project is an exploration in technology to improve the surgical environment. In laparoscopic surgery, the equipment used to gather images is critical to the success of the surgery.
Imaging has to do with creating a picture, and normally we think of that with regular visible light. But when you get inside the human body, where there isn't the possibility of having outside light, you need to light that scene in order to take an image. If you put regular light in there through a fiber optic channel, you can get a visible light image. But there are a lot of other things you can do as well. Ultrasound, X-ray, different spectra from the visible spectrum, yellow light, red light, infrared, ultraviolet. All of those things together collectively we refer to as multimodal imaging.
STITCH researchers began exploring how multimodal imaging could make it possible to use the camera as a measurement device.
First thing, we need to calibrate the cameras to measure and capture the coordinates between the image and the world. Then we have a software, we developed a software to track those tools and measure the distance between them by the left camera and right camera.
It's possible to use these cameras as measurement devices. There's some setup that needs to be done, but our analysis shows that within certain tolerances, we're able to get very good measurements.
In addition to using the camera for measurement, STITCH researchers also wanted to test the boundaries of multimodal imaging to see if it could actually bring out pieces of the anatomy that couldn't be seen under visible light.
The human eye is only able to see certain wavelengths of light, the visible light range. But there's a lot more that electronics, that cameras can see that the eye can't.
You can only see between 400 and 700 nanometers, somewhere around there. And what we're looking at is near-infrared and ultraviolet lights, as well as a lot of the visible light ranges.
The vascular structure, for example, even things that are buried, in fact, in tissue, they haven't been exposed yet operatively, those things can sometimes be seen more clearly if you use a certain kind of light, like infrared light.
This setup, we have light banks with multispectral LED lights, and we can set those up to project whatever kind of wavelength that we would like to see.
This sort of multispectral, hyperspectral imaging has been used in other areas related to medicine, in analyzing various tissues in the lab, but generally not applied to living tissues.
We did some experiments using infrared light to see if that could give the surgical team a better cue in doing the actual surgery than they would have with normal visible light. It's possible to see vascular structure, for example, with infrared light, but you have to wait a little bit of time to expose the scene to be able to see it. So we explored those trade-offs. Are you willing to wait? Is it necessary for things to be more instantaneous? Our results show that if one can wait, one can get an image of vasculature that's very clear, and it's just a matter of how those trade-offs play out.
Through the STITCH project, researchers now have a clearer understanding of the role of multimodal imaging in the surgical environment. Using this knowledge in the future, new on-demand systems may be developed that allow surgical teams to use multispectral lighting, MRI, CAT scans, and ultrasound to acquire critical information in the midst of surgery.